Imagine two clinicians working side by side in the same hospital. They see the same types of patients and face the same type of administrative demands, yet one thrives in their role while the other merely survives. To understand why, let's meet Susan and Dan. Susan has a strong support network, daily team huddles, and wellbeing initiatives. On the other hand, Dan has limited access to these job resources and is left feeling isolated and hopeless about his future in the role. So, who's more likely to burn out? Ultimately, Susan and Dan are both at risk of burning out being healthcare workers, with 26.45% of public health workers reporting symptoms of burnout in 2017, and this rising to 56% reporting at least one symptom in 2021. Burnout has serious consequences like heightened anxiety, depressive symptoms, sleep disturbances, and increased risk of chronic illness. When burnout escalates and begins to impact the majority of healthcare workers and pose serious risks to both their psychological and physical health, understanding what drives burnout and stress is not only justified, but necessary. So, who do you think is more likely to experience burnout and stress? To understand why some clinicians burn out while others can remain engaged, let's consider an underlying theory behind burnout and stress and how this plays out in a real-world case study, the job demands resources model.
There are several psychological theories that explain stress and burnout in the workplace. However, this presentation will focus on one in particular, the job demands resources model, also known as the JDR model. The JDR model, proposed by Bakker and Demirati, explains how burnout develops through the interaction between workplace demands and the resources available to cope with them. Job demands refer to aspects of a role that require sustained physical or emotional effort, such as workload, time pressure, and emotional strain. These demands are not inherently negative, but when they become excessive or prolonged, they can lead to strain and exhaustion. In healthcare, these demands are particularly high due to exposure to complex cases, long working hours, and continuous patient care. In contrast, job resources refer to the support systems available to help employees manage these demands. This includes factors such as supervision, autonomy, adequate staffing, and workplace wellbeing initiatives. Job resources are important not only for reducing stress, but also for maintaining motivation, engagement, and overall job satisfaction. According to Bakker and Demirati, burnout occurs when job demands are high and job resources are insufficient, creating an imbalance that leads to emotional exhaustion and disengagement. Over time, this imbalance can result in reduced performance, lower well-being, and increased risk of burnout among employees. This model is particularly valuable because it shifts the focus away from individual resilience and instead highlights the role of organizational factors in driving burnout. This is especially relevant in healthcare settings, where high patient loads and limited staffing often place excessive demands on workers that cannot be managed by individual coping strategies alone. As a result, the JDR model not only explains why burnout occurs, but also provides a framework for how organizations can reduce it by increasing workplace resources and improving support systems. With this framework in mind, let's consider the empirical evidence to see how well this model is supported in real-world settings.
According to Demirati and colleagues, job demand, for example workload and time pressure, were the strongest predictor of emotional exhaustion. In contrast, a lack of job resources like autonomy and supervisor support were the strongest predictor of disengagement from work. Importantly, this two-factor structure confirms that reducing job demand is not enough to reduce burnout and stress. The inclusion of adequate job resources is equally important in maintaining engagement and encouraging employees to stay in their roles. When we look at healthcare workers specifically, it becomes clear that the job demand and resources model isn't just a theory, but plays out in real life like employees within this system. About 53% of healthcare workers report moderate to critical burnout symptoms, with higher rates in frontline settings like emergency and ICU workers. So, what drives this pattern? According to Mijakozy and colleagues, organizational factors are more strongly associated with burnout than individual traits like personality and resilience. Furthermore, excessive workload and lack of supervisor support shows a moderate to strong correlation with burnout. More recent research adds that it's not merely the presence of job resources are reduced burnout, but whether these supports are appropriately aligned to the specific demands of one's roles. Ginny and colleagues found that all healthcare professions investigated experienced significant job demand. The specific type of demand varied across roles. While physicians reflect greater impact of decision-making pressure, nurses experience higher patient-centered demand. As a result, the effectiveness of job resources available become mediated by how well they address the type of demand within a healthcare worker's role. This highlights that burnout is not reduced by generalized support, but specific job resources that tolerate the job demand as outlined in the job demand and resources model. With this in mind, tackling burnout becomes more than an individual problem. It is an organizational level issue that requires job resources to be implemented by specific industries within the healthcare system. To see whether these qualifiable results hold up in practice, we'll now turn to a real-world case study that explores a more personalized experience with burnout.
To explore how these theoretical and empirical findings translate into real-world impact, our case study focuses on clinician experience at the Black Dog Institute, a not-for-profit organisation that uses evidence-based research to provide treatment for individuals with mood disorders. When conducting a brief anonymised interview with a clinical psychologist who works at the Black Dog Institute, the interview was structured around the key components of exhaustion and disengagement as was conceptualised in the JDR model. While analysing company reports regarding job resource implementation could provide useful organisational insight, it may not completely capture the lived experience of clinician burnout and stress within the system. Therefore, as we have already covered quantified evidence of this model, we prioritised a primary interview to capture the qualitative and individualised aspects of the JDR model. Given the emotionally taxing nature of work as a psychologist, it was clear this clinician experienced high job demands and exhaustion, particularly in the form of time-constrained sessions and complex case management. In particular, they noted that even though you're taught in training to maintain boundaries to avoid emotional overload, sometimes you can't help but be swept away by these real humans with their real stories. This directly reflects the JDR model. Complex workload and time pressure function as job demands and are key predictors of emotional exhaustion in healthcare workers. In contrast, when discussing job resources like wellbeing tools, the clinician emphasised that support is what keeps us clinicians engaged and showing up each day to do it all over again. They described having access to a range of resources, including an employee assistance program, a dedicated wellness room, and additional mental health leave to relieve the burden of carrying symptoms at work. However, they also noted that resources may not always be enough to eradicate the exhaustion from high job demands, and that therefore boundaries around employer expectations are equally valuable. Researchers in the Black Dog Institute found that organisational initiatives enhance well-being, engagement, and reduce burnout in doctors, nurses, and allied health professionals. In response to the growing job demands of healthcare workers particularly, the Black Dog Institute has developed the Essential Network program, which gives workers access to 5 free psychology sessions to address burnout and stress. Reflecting on working as a psychologist within the program, the clinician pointed out that when you see how these workers come in for their first session and how they leave after the 5th session, it really highlights how important wellbeing programs are. Within the Job Demands Resources model, this program operates as an additional and specific support measure, particularly for employees with limited job resources in their own workplaces. In summary, this case study provides real-world application of the JDR model. While the demands of a job can contribute to emotional exhaustion, the resources available to employees are critical in determining whether a clinician remains engaged in their work. However, it is not merely the availability of resources that matters, but also that there are boundaries which prevent demands exceeding what resources can support. Therefore, the best practice should involve organisations implementing targeted support systems synonymous to the Essential Network program, incorporating supervision, and establishing workload management strategies which are tailored to the specific demands of each role. On the other hand, organisations should also encourage employees to maintain clear and positive boundaries around what is realistically achievable in their work.
Checking back in on Susan, those green icons aren't decoration. They give her room to absorb pressure and keep going without breaking stride. But with Dan, the red crosses point to something structural. He is trying to build a house, but with jelly as support. Don't tell me that won't work. So when Dan burns out, it's not just a reflection of him, it's a large reflection of the conditions around him. This is the JDR model in practice. Susan's resources keep pressure within a workable range. Dan doesn't have that same buffer. When demands keep exceeding resources, effort does still matter, but it's a constraint that shifts to the system itself. Individual strategies help at the margins, but they do not correct the imbalance. So when stepping back, we already know what sustains employees in healthcare workplaces. When those conditions are inconsistent or missing, the outcomes follow a pattern. This isn't just about individuals managing better, it's about whether the system supports that effort at all. So the question isn't how much more clinicians can take, it's how long can they carry a system that doesn't carry them back.